of genital tract infection? Yes, you have, but you might not know it to be genital tract infection. We commonly call it toilet disease or toilet infection. This is Royal Care Counseling Outreach, and of course, I still remain your online counselor. My name still remains Rachel. So let's talk about genital tract infection. It encompasses a variety of infection that affects the genital and tract area of a male and female reproductive system. For the sake of this video, we are going to concentrate on only the female gender. I'm sorry if I am letting the male gender down. We are going to talk about that in the male gender some other day, but today, for the sake of this video, let's concentrate on the female gender. We are going to be looking at the classification of genital tract infection. Like I said, genital tract infection is usually or commonly called toilet disease or toilet infection. So let's look at the classification of genital tract infection. Number one, we have the lower genital tract infection, and number two, we have the upper genital tract infection. However, the upper genital tract infection cannot be in occurrence if the lower genital tract infection is not in existence, meaning it's the lower genital tract infection that leads to the upper genital tract infection. That is, if the lower genital tract infection is not properly treated, it can escalate to the upper genital tract. Lactobacilli is the most common organism implicated in the lower genital tract infection. That is the most common. Lactobacilli is normally in the vagina. It can increase or decreases depending on some of these factors. Number one, how active the woman is sexually. Number two is pH. That's how active the vagina is, how occasionally the vagina is being active. I am going to be listing the most common lower genital tract infection, which most females refer to as toilet disease or toilet infection. I am not going to be explaining them so that you will go to see your doctor for adequate treatment. Number one is vulvar vaginal candidiasis. Number two, we have trichomonasis. Number three, we have bacterial vaginosis. Number four, we have genitourinary chlamydia. And of course, number five, we have gonorrhea. See, trichomonasis and gonorrhea, they are sexually transmitted disease. So let nobody lie to you that it is a toilet infection. That's a big lie. Both of them are sexually transmitted disease. Before I list the symptoms of genital tract infection, let's explain about vaginal discharge. Vaginal discharge is whitish in color. However, because of some exposure to air, it can be yellowish. So you should take note of your vaginal discharge. Here are some symptoms of lower genital tract infection. One is abnormal vaginal discharge. Just like I said, a normal discharge is usually whitish in color, but the exposure to air leads it to become yellowish. However, your vaginal discharge will help you to know the tract infection that is in occurrence. Either it is mucopurulent, greenish yellow, or it has foul smell. This discharge will help you to be able to detect the tract infection that is existing in you or that is occurring in your body or in your vagina. Number two, intense itching. People believe that intense itching is only common when you have gonorrhea. It's not only in gonorrhea cases you have intense itching. So I want you to take note of that. Number three, we have vulval soreness. It is usually common when you have trichomonasis. That is, the vaginal walls are extremely dry. There's intense dryness in the vaginal wall. Those are part of the symptoms you should look at to know that you have genital tract infection. Don't always conclude that, oh, this is just toilet disease. Number four, we have rectal discomfort. That is discomfort or feeling of uncomfortable in the anus. When you are not comfortable, you are not feeling okay around your anus. That is another symptoms you should look out for. We also have dysuria, very difficult to pass out urine. When you're finding it difficult to urinate, that is another symptom you should look out for. And of course, number six, we have frequency. When you are occasionally visiting the toilet, every few seconds you see yourself running to the toilet to pass urine. That is another symptoms you should look out for when it comes to genital tract infection. We also have bleeding after sex. After sexual intercourse, you see yourself bleeding. That is another tract infection symptoms you should be aware of. Let's talk about the risk factors of genital tract infection, things that predisposes one to genital tract infection. Number one is pregnancy. A pregnant woman is immunosuppressed, so her immune system is not usually active to fight genital tract infection. Number two is diabetes. When you have diabetes, you are immunosuppressed, so in most cases you find out that you are always having genital tract infection because your immune system is not strong to fight those tract infection. Number three, we have HIV. An HIV person is immunosuppressed because the immune system cannot fight some little infections that are coming into the body. So number four is high dosage of COCP. I talked about COCP in my previous video on fibroid. Please, if you are new here, please don't forget to watch my previous videos. They are very educative. You will love it. COCP means combined oral contraceptive pills. When you constantly use high dosage of it, you are at risk of having tract infection. Number five, we have multiple sexual partner. Once you have more than one sexual partner, you are at risk of having genital tract infection because number one person can infect you, number two person can infect you, number three person can infect you. Because they are multiple, you don't even know who is the carrier and how they can even treat themselves, because you can end up treating yourself, and once you go and meet the carrier, the person will infect you because they are multiple. Then number six is poor hygiene. When you see a situation whereby you don't clean up your toilet regularly, how can you clean your toilet once a week as a woman? That's very dirty. Occasionally try to clean your toilet, wash your undies. You are not supposed to use one undies for a week. It's not a good hygiene. Please take good care of your personal hygiene. Let's talk about diagnose. That is how to know which genital tract infection is causing any of those symptoms I listed above. Microscopic culture sensitivity. That is, in most cases, once you are being examined, they make use of cotton wool to carry out a sample of your discharge for a test to be able to diagnose which tract infection is actually causing those symptoms I listed above, or which genital tract infection is disturbing you. The treatment of genital tract infection is an antibiotics by the choice of your medical practitioner, your medical personnel. So you don't get to use any antibiotics that is not prescribed, that you are not asked to use. If not, at the end of the day, after using diverse antibiotics that you are not asked to use, it will not allow the main antibiotics to work in you. Your immune system will be fighting against the normal one that is supposed to work for you. And I want you to take note of this, that there's no upper genital tract infection without the lower genital tract infection. However, if you are feeling ashamed to talk about this infection, that's why the counselor is available. Make any bookings with the counselor. The counselor will help you to be self-informed and to make an healthy decision on whatever you feel is affecting you. So now let's go back to the upper genital tract infection. When we are talking about the upper genital tract infection, we can also talk about pelvic inflammatory disease, PID. However, this inflammation and infection arising from the endocervic, accessing to the body of the uterus, fallopian tube, and of course the ovaries and the perimetrium. Let's look at the causes of upper genital tract infection. Number one is gonorrhea. Gonorrhea occurs in 30% of patients facing genital tract infection. Number two, we have chlamydia trachomatis. That occurs in 30% of patients that has upper genital tract infection. Number three, we have mycoplasma hominis. That occurs in 10% of upper genital patients. Others like E. coli and staphylococcus are some of the causes of genital tract infection. Just as I said, if you don't treat lower genital tract infection, it's going to escalate to upper genital tract infection. Some symptoms of upper genital tract infection. Number one, we have abdominal pain. When you are feeling abdominal pain, go for a medical checkup. Pelvic pain, number two. Number three, abnormal vaginal discharge. When you notice your vaginal discharge is not normal. I told you the normal vaginal discharge is white. When exposed to air, it becomes yellow in some cases. So when your vaginal discharge is not normal, that's another symptom you should look out for. We also have nausea and vomiting, fever, headache. That's another symptom you should look out. The next number is intense heavy menstruation or painful menstruation. When your menstrual flow is heavy or painful, that's another sign you as an individual should look out for. Number six is pain or pains during sexual intercourse. When you're having sex and you are feeling pains, that is another sign of upper genital tract infection. We also have infertility. When you are finding it difficult to conceive, that is another sign or symptom of genital tract infection. I want us to take note. In severe cases of PID, pelvic inflammatory disease, admission is suggested. So that administration of intravenous antibiotics can be administered to the patient who is faced with upper genital tract infection. I hope this video is educative to you, and if you enjoyed this video and you find it educative, don't forget to put a thumbs up, and of course don't forget to subscribe to our channel. We are available for personal social bookings, that is any problem that is affecting you personally or affecting your social life, and we're also available for vocational and career counseling. Don't forget to make a booking now. I still remain your online counselor. My name is Rachel. Bye bye.